Imagine you're in crisis. Your challenges feel insurmountable. Or maybe you just need someone to talk to.
When I was a student here, I had a hard time with depression and anxiety. I would not look forward to getting out of bed, so I wouldn't. I went through an intensive outpatient program, so that was one big thing, and it would have been very helpful to have a counselor, a therapist in school.
Savannah Smith graduated from Rosemary Anderson's North Campus High School in 2017 as valedictorian, despite her obstacles. Now, she works there.
Our demographic is just different. We have students who are dealing with a lot of stressors outside of school, like poverty and like where their food is coming from, if they're gonna get food. So having someone in school that they can just walk downstairs and see is really important to them.
National data shows 1 in 5 children and teens experience mental health issues, and serious mental health problems are on the rise.
Developmentally, they're figuring out who they are. There's so many stressors and pressures, and they may have, trauma that they haven't processed or talked about with anyone yet.
Left untreated, it's linked to behavioral problems and dropping out. Research shows school-based mental health services lead to academic success and improved well-being, along with safer schools.
It's just kind of preventative learning skills to manage things that are hard about navigating adolescence.
Access can be the biggest barrier to getting help. With Lena or Beth, both mental health social workers just down the hall, that barrier is knocked down for students and staff.
With the relationships our school staff have with the students, we are often sometimes the first people to know when something difficult is going on in their lives.
It also helps overcome stigma, because there can be so much stigma around accessing mental health care. And when we're in the schools, they start to know us as individuals who care about them.
It becomes about making kids and their families feel more comfortable. It becomes about trust. They're not stopping here. The school's ultimate goal is to get enough money to put specially trained mental health social workers on each of their 4 campuses. A PYC board member has put on fundraisers over the last 2 years to help pay for the program. Other private donors and grants also chip in to keep it going and, of course, hopefully expanding. Back to you guys.
Looks like they're doing great work. Thank you, Morgan.